Welcome to the Rhode Island Hospitality Association video podcast. I'm Bill Bartholomew. On this series, we're going to explore some of the news and information impacting Rhode Island's hospitality industry.
Hi, my name is Sarah Bratko with the Rhode Island Hospitality Association, and I am here today joined by Bill Bartholomew as we're going to start discussing a new exciting program that Rhode has launched in partnership with the Rhode Island Department of Health. This program enables businesses to test their employees at the convenience of their location using the BinaxNOW rapid test for COVID-19. We have worked on this program for the last several months in an effort to make sure that every employer has the opportunity to test their employees as often as needed. So Bill, I'll leave it up to you to kick us off.
Well, good afternoon and a pleasure. So let's get right into it. What is this about, this partnership between the Rhode Island Hospitality Association and the Rhode Island Department of Health with respect to testing hospitality businesses?
At the start of the pandemic, our board of directors made the decision to really embrace testing for COVID-19 as one of the best ways to combat the virus in restaurants and in hotels. And the reason behind that is, when we first started learning about this virus, the biggest question was, do I have it? And everybody who had a sniffle or a cough was convinced that they were the one that had COVID. And one of the unique benefits that we have in Rhode Island is that we have always had a very good testing platform, particularly when asymptomatic testing was opened up to hospitality employees. So that being said, our industry is based on consumer confidence. If people don't feel safe, they're not going to come out to eat. They're not going to go and stay hotels. They're not going to go on vacation. In the same token, if they don't believe that it's safe because the employees themselves might have the virus or have been exposed to the virus, you're going to see that same hesitation. So this goal was really to tackle that consumer confidence side on the basis of, or on the from the perspective of the consumer. We also wanted to confront one of the real challenges facing our operators right now, insofar that every time an employee who tests positive or may have been exposed, there's a ripple effect across the company requiring that other employees who might have been exposed to that employee have to quarantine, which obviously we want them to do. That's a key in combating the spread of the virus, but it poses an operational challenge. So the sooner you can catch an employee that may have the virus in their system, the more you can minimize that operational impact on your business.
So not only from a broad industry perspective, but also on an individual employee basis, this is an important practice because it gives confidence to the staff on the floor as well that says, hey, look, consumers, people who are showing up for work, whatever it may be, we've done our best to identify anybody who is positive.
Absolutely. And, it's not a perfect system, but it's the best system we have at combating the virus. The really only way, outside of having a vaccine for everybody, the only way to really make sure that there aren't these outbreaks is to make sure that people that are sick stay home. And the best way to do that is so that when people catch the fact that they have the virus as soon as possible. It's entirely possible to be asymptomatic or to be able to spread the infection before you are showing symptoms. So this enables people to hopefully catch it on day one or day two before they have an opportunity to expose their coworkers or even their friends and family. Back when we launched this program, we did a test pilot with one of our board members who has a larger restaurant in Northern Rhode Island. And he opened it up not just to his employees, but to their families as well. Because if somebody in their household has it, that same employee has to quarantine. Or if they have it, then their friends and family will have to quarantine. So the idea behind this was to get as many people tested as possible.
How do restaurants sign up and who is eligible for this program?
It's a very easy process, although there's a couple of things that you have to do. So the Department of Health and the Rhode Island Hospitality Association work together to develop a memorandum of understanding. And this is basically just who does what and what your responsibilities are. We still recommend that any business who's looking to do this program review that paperwork carefully. And if they feel that they need to, have their own attorney look at it. We say that with every contract that anybody signs, always read it. So you need to sign this MOU, and then there's what's called a CLIA waiver that you need to fill out. A CLIA waiver is a waiver developed by the FDA, and it's essentially allowing a non-lab to do laboratory testing. The COVID-19 test, even the Binax now, is still considered a laboratory test. So you need to fill out that CLIA waiver. Once you fill that out, you need to send it directly to the Rhode Island Department of Health. And if anybody is interested in this, they can certainly contact us and we'll send them all of the paperwork. Once they fill that out, it will take about 5 to 7 days for the Department of Health to process the paperwork. You'll then be asked to pay a one-time fee to the FDA to obtain the CLIA waiver. That is the only cost associated with the program, and unfortunately, we can't waive it because it's through the federal government. So once you have that, the Department of Health will contact you to train you and your staff on how to obtain the test, how to administer the test, what the process will look like for making sure that people who test negative and people who test positive get their results in a timely fashion. And then you're kicking off. You can pick up the test at the Rhode Island Convention Center, and you can get as many tests as you need, and contact the Department of Health if you run into any challenges or issues as you go through the program.
So I guess one big question that'll be out there is, will this become full spectrum in the sense that customers can also be tested or should be tested when they show up at a restaurant? Is that something that's on the horizon?
It is certainly part of the conversation. We at the Hospitality Association wanted to make it clear that this is not mandatory. No one is required to participate in this program. If it is expanded into customers, we hope that it will not become a mandatory requirement, just because we don't really want our customers to feel like they have to. But as we roll this out, and if the program works as we hope it can do, it may very well be extended as an option for customers.
For more information, write info@rihospitality.org. That's info@rihospitality.org.